Check any public opinion survey of the professions people respect the most, and year after year, you'll find doctors at or near the top and politicians at or near the bottom. And yet, for the past many years, and lately in particular, both the federal and provincial governments have seemed to declare it's open season on doctors. Let's find out why. For that discussion, we welcome Stanley Hart, former federal Deputy Minister of Finance, now a lawyer with Norton Rose Fulbright; Dr. Nadia Allam, a family physician and anesthetist in Georgetown, Ontario; Dr. Sylvie Matthew, a family physician here in the capital city; and Martin Regcon, politics columnist for the Toronto Star. And we're delighted to welcome you all here to our table tonight at TVO. I want to set this up by playing some tape off the top here. Here is, actually, there's no more videotape. I don't know why I say that. We're going to play some clips. Here's the PC health critic Jeff Urich from the legislature making some comments, and then Eric Hoskins, the Minister of Health, on this program. Sheldon, if you would.
Yesterday, this government's attack on doctors continued. The Minister of Health blamed so-called out-of-control billing by doctors as a reason for his mismanagement. He said doctors are overbilling hundreds of millions of dollars. Is the minister insinuating that doctors are creating patient demand? Mr. Speaker, why is this government blaming doctors for their inability to manage the healthcare system? This government is trying to divide and conquer rather than sit down and negotiate. Mr. Speaker, there are a handful of doctors sitting over there on the government side. Why are they letting their government slander doctors and cut services to patients?
We've overspent the physician's budget by $750 million over the last 4 years.
Cap it. Cap the budget.
Well, again, we are preference, so we have no intention of capping it. We've increased it by about $140 million this year. It has consistently gone up year after year after year, the amount of money, that overall envelope that we pay our physicians.
Jeff Urich and Eric Hoskins. Okay, Dr. Allam, to you first. As a doctor in the province of Ontario, do you feel as if doctors have been put in the political crosshairs by the governments these days?
I do. I do absolutely feel that way. And I think a lot of doctors feel that way across the province. Part of it is that the government keeps focusing and boiling the entire medical profession down to dollars and cents. And when they do that, they miss the humanity of our profession. So they miss the reality of our day-to-day lives. The young mother with postpartum depression, with a newborn baby at home, a husband who's lost his job again and has anger issues, or the young disabled college student who's had to sell her ADHD medications just to find housing and is now failing every single class. Or my senior patients, a senior gentleman, an elderly gentleman who's got heart failure, kidney failure, diabetes, hypertension, and now dementia that's worsening, whose equally elderly wife is struggling to take care of them because the wait lists for a nursing home are 3 years in my area.
So this is what comes through the door every day in your practice?
Absolutely. I see this in my clinic every single day. And when you talk about just the money, which is the tip of the iceberg of what it's like to be a doctor in Ontario, you miss all the rest of those stories.
And that offends you?
Absolutely.
Dr. Matthew, your view.
Likewise, I totally agree. We have been scapegoated for an ever-increasing and demanding population, between the size of the population growing, aging, increasing technology, and needs. We need convenience care, we need more beds, we need long-term care beds, we need hospital beds. Minister Hoskins himself said it yesterday that he's increasing 2,000 hospital beds in the areas that are most needed. But where's the corollary for long-term care funding to take people out of hospital? Not everyone can stay at home. I do a lot of elder care in my population, and you know, we're putting Band-Aids on solutions, and we've been doing that for years, if not decades now. And why do we have an opioid crisis? Well, we're giving out painkillers for managing things that could otherwise be managed in ways surgically, perhaps.
Okay, that's the view from the profession. Mr. Hart, your turn. How does it look to you? Does it look like doctors are being put in the political crosshairs these days?
Well, I think the dishonest part is that the real problem is funding. I know that the two medical colleagues on this panel have argued that we need to look beyond funding, but I think what's happening dishonestly is that the government is trying to lay the blame for its inability, and I think it's a chronic inability, it will never be solved, to switch the blame to doctors who are totally blameless here. The problem is that our beloved system, the third rail of Canadian politics, namely Medicare, cannot and never will be able to fund the needs, and the needs are growing. Pharmacological breakthroughs, equipment and treatment, all kinds of new procedures are developed, and the government was running behind years ago when I was one of a team that won a case in the Supreme Court that said that Medicare was unconstitutional when the services can't be delivered on time. So it seems to me that Dr. Hoskins is, by turning the heat on doctors, is putting the blame elsewhere just to take it off himself.
Martin, your view.
Well, I agree with most of what was said here, except most of what Mr. Hart said. I'll come back to that in a moment. Let's not forget, by the way, that the Minister of Health in Ontario is a doctor. His deputy minister is a doctor, Bob Bell, used to run the UHN Health Network. So I don't think that these two doctors are self-hating doctors. I think they are not trying to put doctors in their scapegoats because they are engaged in any kind of a blame game. And as I think someone pointed out, there are several physicians in the current Ontario government. So this idea that doctors are the bad guy, I think, is not something most politicians would really, that's not a fight most politicians would win. People, including everyone at this table, thinks of doctors in the highest esteem. They do remarkable work. I agreed with what Dr. Alam said earlier about some of the miracles that they perform, but I'm also reminded of teachers who work with kids with autism, or who help kids with special needs, or kids with all kinds of academic requirements. I think of firefighters, I think of nurses, I think of nurse practitioners and pharmacists, as I believe that legislator
Jeff Urich is a pharmacist, yes.
And the work that they do. So this idea that because physicians do God's work, and I'm not being facetious, I mean, because they are involved in life and death matters, which they signed up for, as Donald Trump might say, then I think we need to understand that it's a vocation, that it is a calling, and it's almost beside the point. When we are talking about financial matters and cash flows, here's my point to Mr. Hart, is I don't think we should accept the premise that more money and more inputs equals better outcomes automatically. We need to look at what's in that black box first.
Would you agree with that?
Well, of course, because it's self-evident, but the problem is that the clip that we were shown that started this discussion was an accusation about turning the blame on doctors, and Dr. Hoskins on this program said that the physicians had overbilled by, I thought the number was $350 million, which you pointed out was a very large proportion of the budget. So he made it an issue of money. He wasn't making it an issue of services and how to deliver it. And that was why I said that he was trying to take the blame off himself, because after all, he may be a doctor, but he's also the Minister of Health. And he knows he hasn't got enough money, and he knows he never will.
He called a news conference several months ago to point out some, what he thought were very troubling facts. And Sheldon, if you would, let's bring these graphics up, and we'll share this with the folks around this table and the folks watching us at home. He pointed out that the Ontario taxpayer gives total compensation of $11 billion a year to Ontario's doctors. He said the average doctor's salary was about $368,000 a year. And I think in a bit of the kind of, name and shame game, he pointed out there are 500 doctors in the province billing more than $1 million apiece. Now, Dr. Allen, I guess the reality is if you're a government and if you're trying to balance the books and if you're trying to hold the line on costs, is there a better place to start looking for cuts than the biggest single line item in the Ministry of Health's budget, which is your salary?
For one, it's not the biggest single line item, right? The nursing budget is about equal to the physician budget, and it's because together we take care of 13.7 million Ontarians.
Nurses are their political allies. You're not. There's a big difference there.
I don't know. Around negotiations, I've noticed that this is what the government's pattern seems to be. I think if they want to focus on balancing the budget, being fiscally responsible, all kudos to them. But they do the blame and shame game a lot. And in public and in the media, they resort to it as a negotiating tactic. And that part is the part that troubles me. Because you can reach dialogue, you can reach consensus, you can reach partnership without having to be antagonistic. And I don't see that from our politicians anymore. And that makes me sad. I guess it's a bit naive. I thought that the politician's job, our political leader's job, is to serve the interests of the public. But if they're busy vilifying that public, if they're dehumanizing them, by only talking about how expensive they are, how they're over budget, how they're this, how they're that, they're a burden on society. How exactly are they to cross the road and actually become partners in taking care of them and serving them?
Let me follow up with Dr. Matthew. I mean, you've pointed out you feel like you are in the political crosshairs. Do you think it affects your practice?
I think it can affect our practice, and that's simply because it, as Dr. Elam said, it dehumanizes and demoralizes physicians when they're trying their best to sort of juggle things and put Band-Aids on the cracks of our healthcare system, trying to find ways to sort of make sure somebody gets to be seen by a specialist earlier or gets an OR date because there's a cancellation by somebody else.
How many docs in your practice?
6.
6. And you talk amongst yourselves, I imagine, from time to time about how things are going?
Well, we share an office, so we talk about it daily.
Okay, and I presume everybody feels the same way you do?
Absolutely.
Everybody feels under the gun right now?
Yep, and has been under the gun for years.
For years?
Yep.
Any theories as to why that is?
Same, it's not rocket science. Aging population, increasing technology, and more needs.
But why do you feel targeted by politicians?
Because as Dr. Elam said, or as you said, it's a blame and shame game to sort of say, well, doctors are billing this much, but we don't recruit people on the street to come in and see us. They come because there's a demand and there's a need and they're looking for help. Patients need help. We try to provide it.
Are they a sort of convenient, handy, I don't know if this is a politically correct expression anymore, but whipping boy, for lack of a better expression, for politicians' ills? Well,
of course, because look, first of all, what they earn is not a salary. Let's get that straight. They bill a single-payer system, which pays them, but they bill for services. And the reason 50 people bill $1 million or more is because the people show up at their door. If there's an implied criticism that they're padding their billings, that they're sending people for tests that they don't need or seeing them more often than required, let Dr. Hoskins say that. But the mere fact that they have this demand at their door is not a reason to reproach them. And of course it's easy, and I say once again, is to take the heat off government. Look, the case that I won in the Supreme Court was a Quebec case.
That's the Shawili case?
Yes, and in Quebec, the principle was if something can't be delivered in medically advisable time, decided by the profession itself, not by a worried mother, then it needed to be put on a list. It started off with knee and hip replacements and cataract surgery. There are now 59 procedures that used to be paid for by the system that can't be and are now acknowledged by the Quebec government, unchallenged by the feds, because how can you challenge a Supreme Court decision under the Canada Health Act? 59 procedures, and it's going to grow. The answer is the demands on the system cannot be matched, and they know, politicians know, that if they were to say, well, Medicare is unsustainable, we need to do something to change it, that's the third rail. They've just stepped on it, and they fry.
Martin, one of the things politicians also know is politics. And they usually are pretty smart about which enemy to pick when it's in their own self-interest. Why is it smart politics to go after doctors? Because clearly both levels of government are doing it right now.
I'm not sure politicians have just gone after doctors. In the last few years, after there was an economic downturn in 2010 and the government had huge problems with their cost curves being a bit out of control, they went after teachers, to use your phrasing, and they had a really tough fight with teachers. They went after nurses, to borrow your words. Again, so-called political allies. Teachers, certainly political allies. They advertised for the government during many elections. So they were looking to try to save money. So it wasn't just doctors who were being targeted here. The idea that they are trying to pick a fight with the most popular segment of the population doesn't really make sense from a political point of view. In fact, if you look at the early years of the Liberal government under Dalton McGuinty, doctors had an increase of approximately 60% in their fee schedules. And that made them the best paid doctors in Canada, which they still are. Now, what's the right amount is a very tough negotiation. Mr. Hart is a long-time negotiator, labor negotiator. It's never easy in labor negotiations. We all know that. But this idea that fee for service is the best model, and that we should not look at how that model might actually accelerate costs and not allow a government to keep any control over this significant part of their budget. I mean, the health budget is over $50 billion a year. It's about over 40% of the provincial budget. As you say, 11 to 12 billion of that goes to doctors. Doctors need to be our gatekeepers in a way, but they also need to be partners, and I think that's what the government is looking for. One last point. Kathleen Wynne, whose dad is a doctor, as she keeps reminding the OMA, I'm motioning to Dr. Allen because she is the will be the next president of the OMA, and Kathleen Wynne reached out a few months ago. It's not widely known because she's trying to get a deal. Why is she trying to get a deal? Because there's an election coming along soon. So this idea that they are trying to put doctors in their crosshairs, I'm not sure that's politically true.
No, but look, there's plenty of the politics of envy out there, and these folks make the most money of pretty much anybody in society, except for professional athletes and so on. It's catching, apparently. Your thing that you've got in your throat, I've got in mine now.
We have two doctors here who can help us if there's any problem.
What about that? Do you think any of these governments are playing the politics of envy here?
So when you say they, I think we all have to be careful not to generalize, just like we shouldn't stereotype in life. So they, the doctors, there's about 30,000 members of the OMA. And they're not just they. There are general practitioners, family practitioners. My brother the doctor would kill me for saying GP. That's old-fashioned. There are family practitioners, primary caregivers, and there are specialists. And the fee schedule is a big, ugly, messy black box full of thousands of codes and so on. And so an ophthalmologist, as a common example, gets a significant fee for doing corneal transplants, remind me. Which, years ago would take half an hour or longer to do. Now it can be done much more quickly with technology. So technology raises costs, but it also can lower costs. So you have radiologists and ophthalmologists who make far more quantums than family practitioners. So when you say the politics of envy, most people aren't thinking about family practitioners whose incomes after overhead are often less than $200,000 a year.
They're thinking specialists.
Yeah, they're thinking about people who are earning millions of dollars, not because they're cheating, but because they are making large amounts of money that might be because the fee schedule needs to be tweaked. And that was part of the last negotiation.
Let me, Dr. Allen, pick up on another angle of this with you, and that is you're not paid like everybody else is paid, right? You basically got one person, and this is one of the criticisms that I hear of doctors, is that they do a lot of complaining given that they're not really small business people. They have no unpaid bills ever. Unlike the small business person, for example, who, you mentioned Donald Trump earlier. Sometimes, the person on the hook decides they just don't want to pay. You're never in that situation. You don't have an unpaid bill. And therefore, that needs to be recognized as part of this discussion. Fair point?
So that's not entirely true.
Where is it not true?
So for one, Mr. Collins' right. The schedule of benefits is outdated and needs to be updated. However, it's also not able to cover all of the different cares that physicians provide now, all of the different services that physicians provide. And so often, physicians will resort to cobbling together different codes, talking to the government, talking to the Ministry of Health, to try and get paid for doing complex surgeries that the schedule of benefit does not cover.
So you sometimes do have to fight to get paid?
Absolutely.
You do.
The other thing is the Ontario government capped the number of family physicians who can start practices in patient-enrolled models. That's the best way of taking care of patients with current data and with current management. It's where a group of physicians can take control of a patient's care, can work with allied health professionals. It's team-based environment. It's what all new family doctors are trained in. And now the government has stopped allowing people to set it up. So for example, one of my colleagues in Oakville, she is a GP anesthetist like I am, so she wanted to start her family practice. She and her husband put down millions of dollars to buy a property so that they could have 5 family doctors working there, 2 obstetricians, gynecologists, and a pediatrician. When these new rules came in, they couldn't open up their clinic anymore because financially it was a no-go as far as trying to work through it with a fee-for-service system. You had to work in a patient-enrolled model to make it financially viable. They shut it down. They've not been able to start at all. So she'll never get to be a family doctor because of these rules. So there's some certainty, but it's not as
100%.
Absolute as a lot of other people say.
Can I just quickly jump into your question? That is the elephant in the room, that to your question about unpaid bills. My brother, I'm going to make him watch this program tonight, works in the US, and that's a problem for American physicians that Canadian doctors never talk about, unpaid bills, because they don't have Medicare. So that is one of the backstops. in our system that most of the time, unless there's a foreign tourist coming in, you'll get paid. And that's different from small business. It's also different from American physicians. And part of the complaint here is it's just untenable to practice in this country anymore. Go to the US, don't get your bills paid, and then pay your malpractice bills. And you'll see that Canada doesn't look quite so bad after all. It's not perfect, but it's not nirvana next door.
But that's not the complete story, because my family doctor sends around a sheet every year of things that are not covered by the system and that he invites me to pay a fee for through an agency that runs these programs for doctors, so that he doesn't have to charge me on a case-by-case basis. If I were not to subscribe to this supplementary insurance, he would charge me on a case-by-case basis for a variety of things he's allowed to. And when Shauli comes to Ontario, as it undoubtedly will, because Dr. Graham Day in the BC is a Supreme Court case coming, and then this will become a national rule. There'll be thousands of procedures that will be done outside the system, and there won't be a single payer, and people will have to collect their receivables.
You wanted to take that on too.
Yeah, I have a couple of concerns with what Mr. Cohn was saying.
We can call him Martin here. He's just a journalist. That's all right. Yeah.
One is we are always comparing ourselves to the U.S. and their medical system, and I think that's unfair. The U.S. system is not great. It's got hundreds of problems, if not thousands, and that, to me, is an insufficient comparison. Why aren't we comparing ourselves to Scandinavian countries? I'm looking for better than mediocre here as a physician and as a patient with elderly parents. Secondly, the unpaid bills comment. While we do have a single-payer system where we are getting paid, sometimes not, but that's sort of a moot point, we are getting cuts, and they can be happening arbitrarily. And in Ontario, we've been having them for 4 years now.
Unilateral cutbacks
unilateral
by the province.
cutbacks, which I don't know if that would be legal in any other industry. So you're taking on the risk of starting a business. I was considering starting a women's clinic. I don't want to take that risk on when my fees schedule can be arbitrarily cut back at whim. Tax changes can happen at whim.
I think we could agree that you mean clawbacks, right? Not the actual overall envelope is increasing, but they claw back if the actual annual amount
But also fee
exceeds.
codes have been cut. So
Sure.
so the profession has received clawbacks, but then individual specialties, including family practice, have had actual fee codes cut.
Sheldon, let's go to the top of page 3 here. I want to read something that I read in my Toronto Star about a month ago. Parliament resumed in Ottawa on Monday. Like many others, I watched Canada's Prime Minister stand up on national television and make doctors sound like wealthy tax cheats. He also slammed any elected MP for, quote, standing with doctors. Over lunchboxes and school bags, I looked at my husband. Our kids are not going to be doctors, I said. I don't want them to ever feel this way. Shaken, betrayed, ashamed for my life's work. That was written by the woman sitting to my right. And some people reading that are going to wonder whether you're being overly dramatic. What do you say?
I would say that I had a very emotional reaction to what I was seeing. When the Prime Minister of Canada stands up and targets a specific segment of the population, it's doctors in this example, it's upsetting. And it's partly because, actually mostly because, he's not just Joe Blow politician here. He is the Prime Minister. He is our representative to the world. So when he speaks, whether it's in Parliament, whether it's in a magazine interview, whether it's on TV, whether it's on Twitter, he is speaking on a national stage. And what he's saying to the world is Canada thinks its doctors are less. We don't value them.
Well, here's what he would say. Listen, I'll let him speak for himself. This is the Prime Minister of Canada in the House of Commons regarding the politics around his tax reform plans. Sheldon, roll it.
Mr. Speaker, there is no suggestion that any Canadians aren't following the rules. The problem is the rules we have currently favor the wealthy over the middle class. We have a system right now that allows wealthy Canadians to use private corporations to pay lower tax rates than middle-class Canadians. That's not right. We got elected on a commitment to change that system, which is why the first thing we did was raise taxes on the wealthiest 1%, lower them on the middle class, and why we're continuing to work on fairness every day.
Mr. Hart, I want you to put on a couple of hats from your past. You're a former Deputy Minister of Finance, former Chief of Staff to Prime Minister Brian Mulroney. So you know about trying to find money and shake it out of the trees, and you know about the politics surrounding all of this. What do you make of what the Prime Minister's up to here? She certainly feels targeted by the Prime Minister of Canada as it relates to the tax reform package he initially brought in. What do you think?
Well, he was just like Dr. Hoskins. He was using doctors to defend an indefensible political position. His indefensible position was that somehow small business owners and operators should be taxed the same way as salary owners, which, I mean, the tax policy for generations has recognized that the risk taken by entrepreneurs and business people entitled them to the encouragement of a small business tax rate and an integration of their business taxes with their personal taxes through the dividend tax credit. He is trying to say that, no, there should be horizontal equity between those two groups, and that's false. And then he picks on doctors because he has a supplemental line, which he's used more generally than just about doctors, but he's used it specifically about doctors, which is that some people have no reason to incorporate except to lower their taxes. And he picks on doctors because of what you said earlier, Steve, namely that they have a single payer, which, you know, for the most part they do for now. The right answer to that is that any lawyer would tell any small business person to incorporate so that they could limit their liability. Now, I understand doctors can't limit their professional liability by incorporating, but so that's what he's picking on doctors, saying, in effect, they have no reason to incorporate other than to save the taxes. He's hiding behind a bad policy and finding doctors to blame, just like Dr. Hoskins.
Let me get your take on this, Martin, on a somewhat different angle here. One of the things that I've heard doctors argue is, you want to claw back our incomes, you want to cut our fee codes, you want to do unilaterally to our incomes what you're doing, that's fine. In the past, you have allowed us, you, the provincial government, have allowed us to incorporate to sort of mitigate some of those losses. Now the federal government, their Liberal cousins federally, are taking away that ability to self-incorporate and therefore mitigate those losses, so they feel like it's coming at them from both ends. In some respects, I'm getting back to my original question here, which is, does it feel like they are sort of, you get me coming, you get me going?
Yes, doctors have an absolutely valid point. They were encouraged to incorporate just over 15 years ago, or allowed to, and nudge, nudge, wink, wink, encouraged to incorporate as a quid pro quo for not getting that much, a bigger increase at that point. I want to just come back to that point, but also to Stanley's point, if I may. The idea, I'm glad you mentioned lawyers giving advice to small business people. I mean, like the doctors here, I have the highest respect for lawyers. But you've reminded us that this debate is not just about doctors. The Prime Minister, who I'm not here to defend, didn't come out and say, I'm going to do a tax change that affects doctors. He's come up with a tax change that will affect small businesses of every kind, or incorporated practices. That means lawyers, who aren't necessarily doing God's work, as the doctors here at the table are. Sometimes they do. It includes accountants. It includes tax accountants. It includes insurance brokers. We're talking about professions that have sheltered, and I use that word deliberately, under the small business tax rate, not because they're trying to reduce their business liability against being sued by some company. They're doing it for tax reasons, to lower their tax rate.
And it's legal.
Absolutely legal, as all loopholes are. Mm-hmm. But that's not necessarily sound and sensible tax policy, and it's not always fair that lawyers should be able to shelter this enormous amount of money. Forget doctors for a moment. They're just taking advantage of what lawyers do. Why should lawyers and accountants be able to get a much lower tax rate and be able to sprinkle it amongst their spouses and adult children in a way that an ordinary working person, a nurse, can't? That doesn't make sense.
Do you want to come back on that?
Sure, because in fact, I love a spirited defense of a policy that has now been admitted to have failed. All of the justifications just offered have been withdrawn, and the tax rate has been reduced, and the sprinkling argument has been taken back to where it always was before the Prime Minister opened his mouth. Namely, if your kid doesn't actually work in the business, you can't pretend that he doesn't pay him a salary. Everything else has been withdrawn. The passive investment thing has been mitigated, again, on a phony argument that only the top 3% of the smallest It doesn't apply to Bill Morneau's private company, but the top 3% of the small businesses will now have their passive investments taxed on some basis that implies they weren't going to use the gains from passive investments to reinvest in the business. I'm not sure what psychiatrist has told Bill Morneau that, or his auditors in the tax department. So stop defending a tax policy that's been substantially withdrawn.
Let's, in our last few minutes here, just try this. Dr. Matthew, let me go to you first. We hear the government say this federally all the time, that we're here for the middle class and those striving to join it. You know, part of that involves going after the rich. And if you make $250,000 a year, which I think most family docs at this table make, you don't have to fess up to that, but anyway, they think you're rich. Do you feel rich?
No. Again, Martin had said it earlier, or maybe it was Stanley, billings are not equitable to salary. My costs as a business owner, or at least a business associate, involve lots of capital costs, not just leaseholds, but now electronic medical records, equipment, hiring staff. If we get cutbacks, if we get tax changes that then tax whatever retained earnings we can keep or passive investment, we lose staff.
So when the Minister of
patient care.
Sure. When the Minister of Health in Ontario says the average doctor makes $368 a year, that's gross, right?
That's
your
gross.
Costs come out of that.
Yep.
You're not taking that home.
Nope.
Do you feel rich?
Not at all. I feel comfortable. I am nowhere near what I was when I was growing up. My husband is nowhere near where he was growing up. He grew up in more poverty than I did. However, I can't say that we're the 1%ers that the Prime Minister is after. We're just middle class. We really are. At the end of the day, if you're talking about numbers, I don't take home the $368,000. I don't know of many family doctors who do. I don't know of many doctors who do. Mainly because when Martin spoke earlier about the physician services budget increasing, part of the reason it increases is not just because of patient need, aging population, and increasing population, and a number of growing technologies, it's also because of inflation, right? So because of that, all of the costs that I pay out to keep my clinic running, to be able to do my job and take care of my patients in a safe, well-run, and well-equipped area, it costs money, and that cost grows with every single year. Some of these equipment costs are hundreds of thousands of dollars, and they can't be found in hospitals.
I got a minute left. I want to give it to Stanley Hart to talk about whether $250,000 as an annual income makes you rich in this country.
Well, the problem is you fall into a statistical and a semantic error. It is true that the tax tables show that actually at $200,000 of taxable net income, you are in the top 1% of income earners. But you remember we had a finance minister named Michael Wilson once who famously said Canada suffers from an acute shortage of rich people. Mm-hmm. And that was the mistake of the PMO and the minister's office and the minister and the prime minister in coming up with this idea that we'd attack people who made $200,000 because they think of themselves as middle class. So he ended up declaring war on the middle class.
So part of this fight here is against people who don't feel rich, but whom perhaps the Prime Minister and the Premier think are rich.
To win points with all the others who may be envious or aspire to getting there and don't like the policy either.
The intersection of medicine and politics. We love the discussion. Thank you, everybody, for joining us here around our table at TVO tonight. Dr. Nadia Allam from Georgetown, Martin Regcon from the Toronto Star, Stanley Hart from Norton Rose Fulbright, and Dr. Sylvie Matthew, a family doc here in Toronto. Appreciate your time, everybody. Thank you.
Thank you.
Thank you.
Help TVO create a better world through the power of learning. Visit TVO.org and make a tax-deductible donation today.